Assalamualaikum warahmatullahi wabarakatuh. My name is Arin Harid. I'm from this group. So today I'm talking about prevalence and factors that contribute to the disease condition. So the condition here is about the glomerulonephritis. So this disease, it does damage to the glomeruli, causing blood and protein to be lost in the urine. So it starts with the acute glomerulonephritis. Okay, so usually it occurs because of skin and throat infections by bacteria, Streptococcus, Staphylococcus, or Pneumococcus. So this tree usually is uh, usually get from people coughing and sneezing. Fungal infections, parasitic infections, malaria usually get from mosquitoes, and viral infections, HIV, which usually get from risky intercourses. However, non-infectious disorders can also be a trigger for disease such as membranoproliferative glomerulonephritis, IgA nephritis, lupus, cryoglobulinemia, Goodpasture syndrome, and granulomatosis with polyangiitis. So all of this are from the same type of autoimmune diseases. So every one of it is connected. You get from getting lupus, you can get membranoproliferative glomerulonephritis. So as you move on to the chronic glomerulonephritis, it occurs to people who already have the IgA nephritis and the previous diseases. And it also occurs to people who have unresolved acute glomerulonephritis. The patients are usually deteriorating in health, and the chronic glomerulonephritis will happen if it's not treated. It becomes the rapidly progressive glomerulonephritis. But in some cases, hereditary nephritis can cause chronic glomerulonephritis. And that's for me. Thank you.
Hello and good evening. My name is Ami Amza bin Ahmad. So I'm going to present about the physiological and pathological mechanism of glomerulonephritis. So GN, glomerulonephritis, as any other diseases involving the glomerulus, are mostly immune related. Most type of GN present with either nephrotic and nephritic syndrome. So nephrotic syndrome are characterized by massive proteinuria, which is a higher than normal presence of protein in the urine, leading to hypoalbuminemia and edema. So the nephrotic syndrome mechanism is the derangement of the wall of the capillaries, which is the podocytes. The epithelial cells are flattened down. So it causes the area around the podocytes to be damaged, making it easier for proteins to escape into the urinary tract. So, and the type of disease that shows nephrotic syndrome is minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy, membranoproliferative glomerulonephritis. And for nephritic syndrome, it is characterized by hematuria, oliguria, which is less urine output than normal, and proteinuria and hypertension. So its mechanism for the nephritic syndrome is the proliferation of the cells within the glomeruli along with inflammation. The inflammatory cells damage the capillary wall, allowing red cells to leak out. So it's harder to pump blood through the glomerulus. So the glomerular filtration goes down. So that's what leads to oliguria. And there is another one, but it is almost the same as nephritic syndrome, but there is some differences that makes its own categories. So it is a rapidly progressive concentric glomerulonephritis. So the syndrome is patients become severely oliguric and develop renal failure. It is somewhat like nephritic syndrome, but the rapid loss of renal function set it apart from nephritic syndrome. It is called crescentic because the glomeruli in this syndrome show crescent-shaped masses of proliferating cells and leukocytes. So that's all. Thank you.
Okay, hello. My name is Idris, and I'll be explaining about the current available treatments for glomerulonephritis. Okay, so the KIB form may go away by itself. Sometimes you may need medication or even temporary treatment with an artificial kidney machine to remove the extra fluid and control high blood pressure and kidney failure. And antibiotics are not used for acute glomerulonephritis, but they are important in treating other forms of disease related to bacterial infection. Okay, so if your illness is getting worse rapidly, you may be put on high doses of medicine that affect your immune system. Sometimes your doctor may order plasmapheresis, a special blood filtering process to remove harmful proteins from your blood. And there is no specific treatment for the chronic form of the illness. So your doctor may tell you to eat less protein, salt, and as well as potassium. And then you also will be needing to take some diuretics or water pills to treat your puffiness or swelling. And then you will be also advised to take calcium supplements, as well as you need to control your blood pressure. Okay, so next, uh, you will also need to take some steroids. Okay, steroids contain prednisolone and are used to help your immune system suppress and reduce your pain. After getting better, the steroids level will be decreased because the kidney already started to recover and function properly on its own. The treatment will be stopped after getting better or be advised to still take the medicine but at lower level. Meanwhile, cyclophosphamide is used for treating some cancers with high doses, and for lower doses cases is for treating the glomerulonephritis. It is a type of immunosuppressant. There are other immunosuppressants that are used to control our immune system, such as cyclosporine, azathioprine, tacrolimus, rituximab, and mycophenolate mofetil. Okay, that's all. Thank you.
Hello, my name is Muhammad Nazli, and today I will present about the limitation of current treatment in glomerulonephritis disease. The limitation is about the recurrence of glomerulonephritis disease after a kidney transplantation has been done. As we know, kidney dialysis and kidney transplant is the only long-term therapies for end-stage kidney disease. But there are many cases reported since the early days of transplantation that there are chances for the recurrence of glomerulonephritis disease and the occurrence of a new glomerulonephritis known as de novo glomerulonephritis in the transplanted kidney. This problem is remain unsolved in the epidemiology of glomerulonephritis. This case happened due to the changing course of treatment by the patient or the doctor and the stubborn behavior of the patient or poor response to the therapy. Approximately 10 to 20% of the patients develop recurrence in the allograft tissue, and 50% of them lose their graft in long-term follow-up that will lead to kidney dysfunctions. There are three classifications of the recurrence of glomerulonephritis disease. The first classification is true recurrence. True recurrence means that the transplant kidney disease are the same as the native kidney disease confirmed by kidney biopsies. The second one is transplant glomerulopathy with unknown primary disease. This is due to the native kidney disease was not determined, but by kidney biopsies, they proven that the native kidney disease are the same as the transplant kidney disease. The third one is de novo disease. De novo means again in English. That means that the transplant kidney disease is different from the native kidney disease. This means that there are occurrence of a new glomerulonephritis disease in the transplanted kidney. There are also many difficulties or limitations in the diagnosis of recurrent glomerulonephritis disease. One of the limitations is misdiagnosis of mislabeling of the patient native kidney disease. The wrong diagnosis is due to the difficulty in determining the cause of native kidney disease in patients with end-stage renal disease (ESRD). There are also cases where black patients often labeled to have hypertensive nephrosclerosis. The second one is unavailability in using diagnostic tools approaches for the diagnosis of recurrent glomerulonephritis in total. As example, immunofluorescence and electron microscopic examination is not practiced on all kidney transplant. The last one is it is difficult to discriminate glomerulonephritis disease whether it is a drug toxicity or alloantigen dependent chronic immunologic damage to the transplant kidney. It also hard to differentiate between membranoproliferative glomerulonephritis and acute glomerulonephritis disease. There, there are also difficulty in differentiate between primary and secondary IgA neuropathy, usually known as Buerger's disease. That's all for me. Thank you.
Hi, my name is Muhammad Shahid bin Abdul Rahman, KIB1005. Today I would like to present to you new improvement and new assisted device to improve quality life of patients with glomerulonephritis. So we as a biomedical engineer, we would like to create a new vision immunosuppressant and medicines to improve the quality life of patients with glomerulonephritis. So the normal medicines and immunosuppressants contain angiotensin converting enzyme inhibitors ACE and angiotensin receptors blocker ARB. And both of that which stimulates angiotensin converting enzyme 2 ACE2. So the level of ACE2 in the body will increase. But the cons is the normal ACE2 has a binding site, while technically ACE2 is to attach to the cell membrane and be the binding site. But the problem of normal ACE2 is it can also be a binding site of a disease such as COVID-19. So we want to create a new type of medicine for people with glomerulonephritis, so they can take the immunosuppressant without being afraid of getting infected with COVID-19. Next, we like to improve dialysis machine. So people with glomerulonephritis usually has a kidney problem and they need to use dialysis machine. So dialysis is a process where excess materials and waste removed from the body. The blood will flow through the machine and get filtered and will flow back into the bloodstream. The cause is the cost to build the machine is very expensive and they need to hire a trained medical staff to operate the machine. And more of that will surely cost a lot. This is why we want to improve it to become cheap and yet very quality and easy to use so everyone can use, obviously. So we can avoid extra charge by paying the trained doctors because the normal medical staff and doctors can easily operate it. This is why we want to create the improved dialysis machine to help ease the burden for people with glomerulonephritis that has a kidney problem with money issues. Thank you. Next.
Hello, Assalamualaikum. My name is Muhammad Azan Hidayatullah bin Shahidi. Okay, I'm going to summarize all the points for the glomerulonephritis. So, as we all know, glomerulonephritis is an inflammation of the glomeruli, which are the tiny vessel that filters blood and excrete excess liquid. Glomerulonephritis is an immunological disease which will turn the infected patient dysfunctional due to organs slowly failing. The organs that we are talking about is the kidney. The kidney plays a vital part in filtering the blood. The acute disease may be caused by infections such as strep throat, and it also may be caused by other illnesses such as lupus, Goodpasture syndrome, Wegener's disease, and polyarthritis nodosa. Most forms of human glomerulonephritis result from an immunological mechanism that are mediated by the action of multiple elements of both the innate and adaptive immune system. And last but not least, the treatment. The treatment of the patient with the disease depends on the type of glomerulonephritis that the patient has. Okay, one example of the treatment that are currently available are such as changing the diet, changing the diet to reduce the intake of salt in their daily food intake. And another one is the usage of steroid to reduce the pain suffered by the patient. And last but not least, for chronic patient with chronic disease, I found that the mm, kidney dialysis or kidney transplant must be used to treat the patient. That's all from now. Thank you.